Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Strategy Officer, PracticeLink. This podcast focuses on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Workforce Wisdom, Unlocking Recruitment Gold, Building High-Performing Teams with Marjorie Alexander. Welcome, Marjorie.
Hi, Christy. Thanks for having me.
Hi, it's great to see you again.
You as well.
For our guests, Marjorie, passionate about helping organizations and individuals reach their full potential. With 23 years of recruitment experience and 20 years in leadership, she empowers leaders to build high-performing teams and supports recruiters in optimizing their personal and professional development. As a certified Maxwell Leadership Team member, Six Sigma Black Belt, and DISC consultant, Marjorie combines strategic thinking with hands-on experience to drive meaningful results. She is also the author of Recruitment Gold, Essential Steps for Highly Effective Recruitment, a must-read for anyone looking to master the art of recruitment. Let's get started. Marjorie, can you share a bit about your journey in the healthcare industry and what led you to where you are today?
Yes, I'd be happy to. People ask me that all the time. And it's something that I also wrote in my book. None of the recruiters that I've ever spoken with went to kindergarten thinking, ooh, when I grow up, I want to be a recruiter or a physician recruiter. And we all fell into it somehow. So the way I fell into it, I was a flight attendant. And then when my second son was born, I decided both feet need to be on the ground. I need a regular job. So I started working for a hospital system in Texas. And I worked there for a while. I was the administrative assistant to the ER administrator, or medical director of the ER. And that's where I got the first taste, because they needed an ER doctor, and I kind of witnessed how they went about that. And I thought, wow, that doesn't look very smooth. That didn't seem the right process. So anyway, fast forward, I moved to Ohio. And that was still stuck in my mind, that I thought, wow, the way they're going about this doesn't seem to be, the best way. So I moved to Ohio. I got hired for a practice administrative type of thing in a hospital system. And one day a family physician retired. And me and my big mouth, of course, I said, well, who's going to take care of these patients? And they said, well, we'll just get an organization in, and they'll find another physician. I'm like, an organization, like a firm, a recruitment firm, because that's what I had seen, in Texas. And I said, well, how much does that cost? They said, well, whatever, $25,000. And I said, this is famous last words, I have some time to do extra work. Let me try that. That sounds like something I want to do. So I actually, and I'm going to date myself now, fax machine, phone, and desk phone, not cell phone, desk phone, and a phone book, I just started calling primary care physicians in the area. And I hired one. And I had it was such a high, so much adrenaline that I was able to do that. You never think you could do something like that. And I said, well, let me do another one. And before you knew it, I had a department that was set up with several people, which was really exciting. And after that, I went to the Middle East to work. I was the first in-house physician recruitment in the Middle East, the one who set up a department. So that was really exciting, very different. So upon my return, I started working in Florida. I had several leadership roles. At one point, I led 64 people, which was way too many. I had recruitment and credentialing and provider onboarding. By default, people were leaving, so they just handed them over to me. And yes, and now my latest role was with ChenMed. I was leading the national physician recruitment team there. And since September, I started my own organization, InkWise Consulting. And now I'm speaking, coaching, and training, and writing books.
So you mentioned holding various leadership roles over the years. What are some key lessons you've learned, really about, providing solution or strategy for the provider workforce, and equally then, developing those teams that reported to you?
Yes, it's two very important questions. So I was lucky enough to be involved in the workforce development planning at one large hospital system, and I learned what to look for. And it was really, they actually had an external consultant come in to do this, and I worked very closely with this person. And people don't ask the right questions. It's so important to while people are working, to ask stay interview questions instead of exit interview questions. When you're asking an exit interview, people already resigned, they're 1 foot out the door, they already have another job lined up. So just to ask the right questions when people are still there is so important. We cannot assume a physician is going to retire at 65. They might want to work longer or shorter. We don't know their situation at home. So never assume, and really have conversations with people. What are their intentions? Are they, do they feel happy in their role? Things like that. So that is one of the biggest takeaways I had from those sessions. And I've been able to successfully implement stay interviews in different organizations. So that has really made a difference regarding retention as well, which is, of course, a big deal. And then when it comes to developing, as a recruitment leader, developing your own team, I was actually coached by a Maxwell leadership coach. I was lucky that the owners of the organization I worked with provided that to the leaders. And it was mind-opening. It was my eyes opened up because I led teams wrong. I realized I did it wrong, and I learned through the questions and through the answers that I gave how to become a better leader and really pour into people. It's not about telling people what to do and then hoping and praying that they'll do it. You have to touch a heart before you ask for a hand, and that is one of the things that person said to me. And just to really, get to know your team, really pour into them, and lift them up as high as you can. There's something called the law of the lid, which says that if your leader that reports to you, or your team member that reports to you, is at a 5 out of 10, then your leadership can only be at a 5. So if you lift your team up, then you can be a more effective leader as well. Mm-hmm. So I've learned a lot over the last while.
Yeah. I think that's really great advice. I think one of the things you mentioned, the stay interviews, for me, I always felt like organizations, they're like, well, we do annual performance reviews. Like, it's not the same. It's not the same, because what you don't want to do, in my opinion, is combine that element of performance and goals and focus and how do we lift you to what you want to be, versus I think you find out different information in a stay interview, and it usually shouldn't be done by like their direct leader who can affect their compensation or their work hours, or you have to separate those things. Do you agree, or what?
Oh, 100% agree. I think that the annual performance interview or biannual, they are formal interviews. A stay interview should be a casual conversation, even over a coffee, and it should be a very relaxed environment where people feel that they can actually speak without worrying about saying the wrong thing to their boss. So preferably it should be somebody else doing those stay interviews. I 100% agree.
Have you done stay interviews in like small groups? I wouldn't do more than 5, but thinking about nursing units where you've got a large staff, to get through one at a time, and they probably need to be longer than 15 minutes to get people to be comfortable. I think the more you do those types of activities as a leader or in another capacity, the more it's kind of like rounding. The more comfortable people get with you. And, I was always taught, when you're rounding or you're having one-on-ones, the very last thing, is there anything else you need? Is there something I can do for you? Saying that as a leader to your employee are really impactful.
It is impactful. I do always caution people. So, I think the stay interview should be done one-on-one. I don't see that they need to be done in a group setting, because you always have the introverts and the extroverts will do all the talking, so you don't get to everybody. But when you ask somebody, is there anything else you need, or is there anything else I can do for you, they don't know what that is. So usually they say, no, I'm good. So I think as a leader, you need to be specific when you ask that type of question, because otherwise you're not going to get an answer. So that, to be really specific about what is it that you can offer, because what can you do for them? Maybe they don't know.
But maybe it could be what's not working for you today.
Yes.
I have an issue with my Outlook, or my ATS isn't working, or something. Teams isn't working.
Exactly. Yes.
There can be those little things throughout
Should
the day.
definitely not be a yes or no type of a question. Yeah.
As you've worked in varying roles and even internationally, your experience in recruitment, how has that shaped really to your perspective on the evolving workforce challenges in the industry? You touched on retention, which is the biggest one. The other big elephant is just the supply of workforce.
Yes. Yes, the shortage, the famous or the infamous physician shortage. I'm happy to see that more organizations are now open or actually hiring residents, because I've worked for organizations that said, oh no, not a resident. Like, who are you going to hire then? Because the supply is not that big. Specifically, people coming to whatever city you're in, it can be very restrictive. So I'm very happy to see that people are open to hiring residents, specifically freshly trained, fresh eyes, high technology driven. So I think that's really great. As long as you have a great mentorship program within your organization, that can work out extremely well. I'm a big fan of bringing freshly trained residents into an organization, pairing them up with more seasoned practitioners, and then they learn from each other. So the more experienced ones can learn the technology side and the latest, greatest tools that are being used and techniques. And then, of course, the residents can learn from the seasoned individuals about bedside manners, how to deal with administration, how to, work with the organization and the culture and things like that. So I think that's just a win-win situation. I have to go back to that piece that I mentioned about the stay interviews. If you don't have conversations with people, let me give you an example. I worked somewhere and we had a female physician. She was a very shy and she wouldn't speak out. And then we received a resignation after 3 months. And it was because she did not have her lab coat and she didn't have business cards and she didn't know who to ask. And she was just uncomfortable with the whole thing. People didn't hold her hand. People didn't guide her through the onboarding process. So, onboarding, super important. If onboarding isn't done right, then people will not stay. I once worked somewhere and I asked the physicians if the job was as advertised.
Oh, good. Yeah.
And
good
all
question.
of them said no. And it was a big shock. And that's when I realized we need to really look at our recruitment process and, what do we promise? And then also the flip side of that is, how are the recruiters compensated? Are they compensated by bringing a person in, or are they compensated by bringing the right person in? And maybe retention might be part of that deal. So it was a big shock to see that literally everybody said no.
Yeah, and I think those active check-ins, I mean, I've seen onboarding plans, the ones that are really well done to me extend for 2 years. So it's you've got that 30-day, maybe it's 30, 60, 90, 180, and then, but you keep doing that because most physicians and providers, because APPs are moving at a rapid pace as well, relocating or taking new jobs across the street, that they, that is the window of time. Like you said, she was missing her lab coat and business cards, and how much time you put into recruiting to getting her there, patient panel, like all of those things end up being lost revenue that could have been avoided by a couple of easy fixes there.
Very easy. If somebody had just looked out, checked in with her, that would have been easy. So the other thing, of course, within the physician shortage, as recruiters, we have to really figure out what is our message. We can't use generic messages anymore. We know, how do we stand out from everybody else? What is it that this organization has to offer? And it might not be the latest, greatest surgical, robotic, whatever it is. It could be maybe a ladder towards leadership, or some kind of growth plan, or something to do with their family. So really become creative with regards to what are you talking to these candidates about, how are you going to attract them, because the shortage is real. And it's not going to get any better anytime soon, as the population is aging. And every day, what is it, 10,000 people a day, or
At
100,000?
least.
I can't remember what it is, turn 65.
Yes.
It's just, and people, as they get older, their illnesses become more complicated. They need more medication and things like that. So they need more time with their provider. I'm a big fan of physician assistants and nurse practitioners. So I'm glad to see that those professions are growing and expanding, which is going to be very helpful.
Did you know PracticeLink is not only home of the most widely used online physician job board, but we also have our own magazine? PracticeLink magazine has not only won several awards, including 2 ASBE Awards of Excellence in 2023, but it's also completely free. Over 375,000 physicians and residents receive copies of PracticeLink magazine each year, and you can too by visiting practicelink.com/magazine. That's practicelink.com/magazine. Thank you for listening. Now we'll return to the podcast.
So speaking of that, kind of that incorporating APPs into their, staffing models, what other trends do you see kind of emerging that organizations need to be prepared for?
Telemedicine, of course, is huge. A lot of organizations already have implemented telemedicine. You can't expect everybody to come into the office and wait for hours past their appointment time. People don't have time. We're in a very fast-paced world. I watch BBC quite a lot, and they have a great technology segment that I like to watch. And they're showing these like a phone booth. You go in, and there's a virtual person that is taking care of checking your blood pressure, and something comes out of the ceiling, and they check your pupils, and you have to put it in front of your open mouth. I mean, it's incredible. So we have to realize that we're living in a futuristic world. It's not something that's coming; it's already here.
Yes.
And healthcare organizations cannot be stuck in how we have always done it. I mean, those are the famous last words of any failing organization, but this is how we've always done it.
Yes.
We have to go with what works and think about the people that we serve. We serve the patients. What is it that they need? They need healthcare now. They need it quick, and they need it before they get sick. They need preventive healthcare. So the whole prevention piece is very important, because once we take care of patients as they're sick, it's too late. We need to prevent them from becoming sick. So I'm hoping to see more and more organizations focus on preventive medicine as well.
Yeah, I think really focusing on that wellness and the health aspect versus, I think in this country, at least, we've provided sick care for a long time.
Yes.
Because that's what we get paid for.
Mm-hmm.
We don't get paid for well care. And so trying to figure out a way to fix that, if it's some value-based method or something else, because some of the quality measures and the other pieces that have been put in place, they've kind of worked. But when you look, if you look back to a lot of the initial 2015, 10 years ago, when some of those metrics were put into place, we consistently just keep failing. So, it has to be reevaluated somewhere. And I don't think as a country and organization's behavior doesn't change unless you change the payment model.
That's right. Yeah. That's the incentive.
Yes. Unless the incentive, the carrot has changed, they are not going to make some of those investments.
I see a lot of organizations also popping up, utilizing like the blue zone principles, where they're focusing also on, of course, people's diet. Of course, you can only influence patients so much. When people want to eat their hamburger, they'll do it. But to really educate patients and live according to the blue zone principles, where they also have their social groups and their activities and things like that. I think that has become very popular, of course, over the last few years. And I see organizations that implement those principles and they're successful. So
Yeah.
it's very good to see.
Yes. Yeah. And I think just again, like you said, with the growing of the aging, the aging population growth is so severe. We don't have enough people going into medicine as a career, that we're at the front end of it getting really bad in terms of access to care. That's what's really scary. The next 10,
Very
20
scary.
years are pretty scary.
Yes, absolutely. Yeah, I'm
Yeah.
still hopeful that there will be some re-regulation around the visa process for foreign medical grads. Of course, you and I have spoken about that before, Christy, and it's something that AAPPR is very involved in as well. So
Yes.
let's hope that that we can get some more qualified and wonderfully trained physicians into our country.
Yeah, absolutely. I think that that's where, in organizations I've worked in, the ability to either support the J1 or the H1B waivers, even O1's a little bit different, but that was a game changer. And as we move forward, the estimates are closer to 40% of the practicing physician population did their training outside of the US. So those end up being those IMGs that your organization needs to understand how to support them from a visa standpoint, finding the attorneys that can help you, whatever it is. But it isn't easy, but it is totally worth it.
It is worth it. But that brings me to a question, Christy, that I've been thinking about for a long time. Because I've spoken to recruiters who just do not want to deal with visa candidates because it's too much work with the paperwork, too much hassle, the blue ink, all of those things. So how, does a healthcare organization who is in critical need of a certain specialist, do they know that we have a recruiter who just doesn't want to deal with this paperwork? There seems to be the potential of a slight disconnect there with regards to the hiring mentality, and then also what the community needs.
Right.
And this brings me to the extreme important issue of the bridge that has to be built between recruitment teams or recruiters and the C-suite, so that there's open communication, because that can be solved so easily. Because if that recruiter had some kind of support, or if the organization could help find a attorney, it would be solved immediately, and everything would be saved. So the bridge between the C-suite and the recruiters has to be built, and it's severely lacking in most organizations.
Right. Yeah, I would agree. And I think, just because something's hard doesn't mean you should do it. You shouldn't do it. I think you drastically, depending on the specialty, what they are, depending on the specialty, you are drastically cutting your pipeline, from if it's pulm crit, hem-onc, some of these specialty GI, like cardiology, some of them are heavily influenced by people who, have immigrated to this country, that if you're not taking the time, you've made a decision to either keep that service and keep that open for patients, or you're closing. Especially the next 5 to 10 years, it'll be less of your choice. So I think figuring out how you do that now is really, really important. And when you have a great immigration partner, I've worked with some really great attorneys, they help you and guide you through it. They usually do this work at a flat rate fee. So it becomes easier when you have those resources that, in your back pocket.
Yes, very true. And I've found that the physicians are very knowledgeable about the process. They are very knowledgeable. They have friends who went through it. They know the steps. They know what paperwork needs to be done. So it's not as scary. So I encourage any recruiter listening. It's not as scary as it sounds. And I definitely go for it. There are some really great physicians out there that you can hire using the visa process.
Yeah, absolutely. All right, let's talk about your new book. Congratulations again.
Thank you.
Tell us what inspired you to write it, and what message do you hope readers take away from reading the book?
Well, the reason I wrote it is when I first started, and remember the fax, the phone book, the desk phone, I had nothing. I didn't have a template. I didn't know what to say. I had no interview, guidelines, or I had nothing. I didn't know what to offer. And when I became a member, excuse me, of AAPPR, there were so many people helping me. They were sending me templates. They were giving me interview questions that I would never have thought about. And I thought it was time to give back. I mean, I've been in this profession for 23 years. I was actually the first fellow when we still had the fellows. I was the first fellow, and it's time to give back. So I decided to write everything I know down, because I can't teach, one person at a time. I might affect maybe 3 people. And I thought, if I write this down and people will look at my book and read it, I hope it helps people. So it is basically a playbook. Everywhere I've ever worked, I've always created a playbook, because when we would hire recruiters, we would have a playbook. This is how we do it here. These are the questions.
Mm-hmm.
This is the process. And I decided, let me just write this playbook. There are so many recruiters out there who are from all sorts of backgrounds. We're all from all backgrounds. Nobody was born as a recruiter, so we all need to learn how to do this. And I thought, if we have something that's just a general guideline, a playbook of how to recruit, then they can fill in the blanks of how it is done in their own organization. And I'm hoping it will bring value to people. It's really my goal to I like being a mentor, and how best to mentor people than by giving more than one person something that they can take away. So I hope it has information in there that they find valuable. So that's the inspiration.
And your target audience sounds like, probably recruiters, sourcing specialists, leaders.
Yes, but also hiring managers. So hiring managers, a lot of them, they're the ones making the decision. Some of them make the offer. Some of them do the negotiation. They never went to recruitment school. They're not associated with AAPPR, as an example, or they didn't go through any type of training. So it's so important that recruiters, when they are working with hiring managers, and that's a big focus in my book, to be honest, that they work very closely together, and that recruiters train hiring managers on recruitment best practices. As an example, what not to ask. What not to ask. The list is long. The things that you cannot talk about, we all know what they are. So in my book, I wrote, what can you ask instead? So there's a whole chapter about what not to ask and what can you ask instead.
What are some of the biggest misconceptions or challenges that you address in the book?
I think the thing that we can all do better is candidate experience. I think if you work in an organization where there might be some competition, or it might be an undesirable location, or maybe it might not be the best pay, or you're recruiting for a private practice that only offers 2 weeks of PTO to their cardiologist, how can you possibly stand out? And I think people overlook the power of a really excellent, high-quality candidate experience, and how to connect with candidates in a way that you can move them forward into the process through trust, building trust, connecting with them, active listening, those types of things. That is so valuable. Instead of just spouting off, the standard stuff that you offer a candidate, to really connect with them and to really just provide such a high-level, excellent candidate experience, so that they really feel valued, and they really feel you care for them as a person. So I would say that is one thing that I'm very passionate about, is the candidate experience. One of the other areas that I pointed out is the importance for people like me, the experienced, seasoned recruiter, to stay up to date with technology. Okay. It moves so fast, and it will be very easy to get behind and then say, I'm just going to do how I've always done it, and use my Excel spreadsheet and not put in notes in this new applicant tracking system, because I don't know how to use it. I can't find my login. I don't know what to do. It's too many steps, and to just do that. And there's a really true. The stories in there. Some of them are funny, and some of them are actually true. Of a really great physician recruiter who was so good at building relationships, but she just would not use the technology. And it was very difficult to make her do it because, remote, you can't grab her by the hand and put her in front of this computer. And when she left and retired, so much information was lost because it was on her spreadsheet, on her personal computer. So, another piece of advice in there is for people that have been in the recruitment industry for a long time, stay up to date with technology, read recruitment journals, listen to recruitment podcasts like these, really stay up to date and never stop learning, continue to grow yourself. So important.
Yeah. I think that personal investment in your profession and career, just pays off tenfold, for sure. And I think that, anytime you can provide tips in this way, it is gold. I'm glad that you picked a great title, by the way.
Thank you.
Yeah. Any surprises or, things that popped up while you were researching or writing the book that, or, maybe even over the years, your ideas or your opinions have kind of changed on some things. But anything there that you left when you were done writing?
Yes, and I love research. I probably researched a bit too much that I had to pull myself away and say, okay, I need to write something down for the book. I could just keep researching and you get off a rabbit trail. The fact that there are so many AI type of tools out there, I had no idea. We all know there's ChatGPT, Gemini, those types of things, but there is so much that can help us with sourcing, with screening, there's so much, and I have highlighted a few of them. Of course, I'm not endorsing any of them, but just to kind of give examples of things. And I really was surprised how many tools that are out there that can help us automate repetitive tasks, make us more efficient, make us more streamlined. We're doing a lot manually, and we don't have to. There's so much that is there that can help us. So now it's up to the recruiter to talk to our leaders and tell them if, right now the recruitment process takes 9 months, but if I have these tools where these and these tasks can be automated, we have a sourcing AI tool that helps us source, that helps us review, things like that, especially in high volume recruitment. That is a game changer, and that will actually save the organization money. So it's key to present it right to the organization, and it will help the recruiter. Yeah, but that was my biggest surprise, how much is out there.
Yes. Yeah, and I do think that the actual human doing, the conversations, the site visit, those things I don't think will go away. But to your point, leveraging the AI or the technology where you need to learn it now and embrace it, because your competitors are probably already ahead of you in some of those spaces, where instead of getting stuck in the old and that manual process, look for those key places, probably in your Six Sigma training, those key places where if you can automate that frees up your time, right, to do something else.
Yes, and it's surprising what you can find on YouTube, how to do stuff, how to automate stuff.
Yeah, YouTube has a lot of great information, and I think having developed an ATS over the years and finding those key places where it makes sense and where it doesn't.
Yes.
But the data that you're trying to collect to tell the story needs to live somewhere. It's not on an Excel spreadsheet.
Right.
You're not gonna take that and make some big plea that you need more FTEs or you need more resources like a PracticeLink or other tools. The ATS or a CRM, whatever you folks have, those are really, really vital today and moving forward.
Absolutely. And I mentioned PracticeLink prominently in the book as well, because I am probably your number one fan without sounding creepy. Because, why would you go and Google looking for physicians when they're all in one platform? That's another, it's there. That's a tool that's already readily available and, very user friendly. And there are still actually recruiters that don't have a tool like PracticeLink, and they are just scrambling. They're going through lists and they're googling and things like that, and it's just so unnecessary when you have such a great tool out there. So having the tools available and being able to be influential when talking to your leaders, that is key for recruiters to be
Yeah.
successful.
Yeah. Yeah. And I think, I've been blessed over the years to have sourcing staff on the teams, either directly or indirectly reporting to me. And they're key because they pick up those pieces. If you're, a single recruiter trying to do this, it's a lot.
It
It
is a
is a
lot.
lot. And
Yes.
sourcing, you don't get to site visit unless you've spent hours sourcing to find those folks that meet what you're looking for and have an interest in your community. And so I do think it's vital that you leverage those tools. And we appreciate the endorsement as well. So
Oh, absolutely. It's true. And, for sourcers or people that do source, never leave a conversation without asking, who do you know who I should know?
oh,
Because
sure.
they all know each other. They're
Yep.
married to each other, they're family, they went to school together. Physicians know physicians and nurse practitioners know many other nurse practitioners. So,
Yes.
always ask that question and fish for some referrals.
Yeah, I think that's very good. I think the referral piece is something that I've had a few people that have called me for references on friends and things as they've been going through their job search. And the latest one at the very end, and it's a very large executive recruitment firm, and she said, hey, I know that you're not looking right now, but if you know anybody in the future, or you're looking in the future, like, save my contact information. It's just a
Right.
key little point at the end where when you make that connection with somebody, you don't ever lose the chance to give that sales pitch.
Yeah. It's a very famous sales technique.
Right.
Can you
Right.
introduce me to somebody that might be interested?
Yes. Yeah. Yeah. So let's talk a little bit about shortage and burnout. So I think I'd love to hear, maybe as you've been a leader and knowing recruitment it is 24/7. You have people site visits and they're on the weekend or after hours. It's not an 8 to 5 gig. So how do you support the teams that you have led, through burnout? Kind of, how do you help them create some personal boundaries? Most of us are very passionate about what we do, even though we're not giving direct patient care. But how do you kind of protect them and help
Yeah.
them, especially for our new listeners just getting into the industry?
It's very important as leaders to pay attention to what your team does. So when I see somebody on my team sending an email at whatever, 5 a.m., 2 a.m., 11 p.m., I kind of, talk to them the next day and say, hey, I see you're working hard. You have a lot on your plate. And just have that conversation. We had a recruitment coordinator who's so passionate, and she was hourly, so she didn't even get paid for those. She was just, she stopped the clock at 5, but she was still working at night. And so I worked with her, and I tried to figure out how can she be more effective during that 9 to 5 or 8 to 5
Mhm.
time frame. What did her day look like, and what could we delete, and what could we put in its place so that she didn't have to do those emails at night and things like that. But also just talk to your team about the boundaries, the importance of family, and the most important thing as the leader, set the example. Because as a leader, I'm the same way, Christy. I would be, get up at 4, can't sleep. Oh, might as well start sending out emails because your computer's right here, in your house. It's a whole different world. And you have to stop. And do you know that actually in France, it's against the law to send out emails, work emails after hours? It's against the law. I don't know how they enforce it, but I thought that was interesting.
Yeah.
But we need to take a page out of their book. We need to protect our work-life balance, but leaders have to set the example. If we are working on Sunday, don't send emails to your team. Try to protect that.
Yeah.
It's very important.
The key there, you could leverage your technology to delay the send
Of course.
until Monday. Like, almost everything has a delay send, even just texts on your phone now, and you can schedule the delivery for a different time.
That's right. Yeah, I used to do that because I didn't want to set the bad example. And so at 10 at night, I would make sure it wasn't sent until Monday morning, 8 a.m. Then we got 10 emails.
And then they're kind of upset in a different way.
Yes, exactly. But you have to keep an eye as a leader. Keep an eye on your team. If you see, it's great when people have great results and they hire a lot of physicians or a lot of providers. But take a look at how did they do that? At what cost did that happen? Because if it's at the cost of them not spending time with their family at night or their spouse in the weekend or taking care of their parents and things like that, that always has to come first. So lead by example.
Yeah. No, I think that's really great. Really, really great advice. Anything else you'd like to share with the audience?
What I want to share is, as recruiters, a lot of times we are seen as order takers. And I really want to empower every single recruiter. You're the subject matter expert. Stand your ground. Be the voice of your work, and let people know that you know what you're talking about. You know what tools that you need. You know what the shortage looks like and what the supply and demand looks like in specific areas for specific specialties. Don't be afraid to reach out to C-suite. When you do, make sure you have some data. Never complain without coming with solutions. The C-suite, they want to see data. You have the data. Nobody else has it. So be confident and become an influencer versus an order taker. You know a lot. You are very valuable in your organization, and you deserve to be recognized.
Oh, that's great. It's a great message of empowerment. So
yes.
I appreciate that.
That's the word.
Yeah. Well, on behalf of PracticeLink, I want to thank you for appearing on Workforce Wisdom today. For our listeners, please feel free to reach out with any thoughts, insights, or questions about anything we've covered. You can email plmedia@practicelink.com. If your organization is looking for recruitment process improvement, leadership development, or professional growth resources, check out Marjorie's information in the PracticeLink Resource Center. My name is Christy Bray. Thank you for listening to Workforce Wisdom.